Hi everybody, my name is Ashley Bender and I'm here to discuss to the administration about gender-based medicine. This has been becoming more of a popular subject and sometimes an all-around issue on how we're going to address certain individuals, how we're going to approach things in healthcare, and mainly try not to offend anybody in any type of way. So I'm going to go through here of the list of questions that we need to cover here today and just discuss mainly definitions, how we can go about with improving ourselves, and just an overall learning of what we can do better for the community in general. So the main question is, what is sex? Is it an act? Is it gender? What is it? So sex is mainly two categories. It is determining if you are male or female. This happens very early on in life. And once that is determined, you are assigned a gender. You are male or you're female. And that's where it comes to being biological. It's when you're born, you're either male or you're a female. Males do other things differently than females. Males cannot have babies. Females can. Males form testosterone. Their behaviors can be very masculine, buff, active, very strong-willed. Females could be those as well. They produce estrogen, but they are known to be very emotional, maybe sensitive, maybe quiet. It's sad that I have to think this way because that's just how we were raised. But that's not the case. Men can be vulnerable. They can be quiet. They can be sensitive. They can, like Pink, females, they can be masculine. They can be active. They don't need to be in these blocks as we were raised to believe. And that's where everything comes down to today of where do we draw the line of, okay, this is how we approach people and this is how we shouldn't. And as I've grown up, there has been many changes regarding sex with genders like female or male, and sometimes they don't even want to be identified as a gender. They want to be non-binary, and that's up to them. However, as it's becoming more and more common, as a healthcare administration, we have to figure out how we're going to handle this. How are you going to handle approaching patients? How are we going to approach not offending them in any type of way? So one of the questions were how the complexity of gender identity creates challenges for healthcare professionals who must treat the biological sex of patients who identify with the opposite gender. Before we even know it, in most electronic medical charts, it tells you if they are transgender or they do not like to disclose what gender they are. And we usually know it before as an X-ray tech bringing the patient back. However, we shouldn't even be looking at that. We cannot address anybody with he, she, her, him, no pronouns like that. Everybody should be addressed as them, they, you. How are you today? Try to avoid using sir. Avoiding using ma'am. The thing is, that person may look like a man, but they identify as a female. So if we go, how are you doing today, sir? They'll be very offended and maybe correcting us and putting us in an awkward position. So the main goal is trying not to addressing them using their gender. And also, one thing that I have noticed in the medical field that I have come across, which is very awkward. When I first figured it out, I didn't know how to approach it. Now I'm getting a little bit more comfortable because I see it. So in one of the electronic medical records that we use, we have to ask females if they any chance of pregnancy, when their last period was. And if their chart, they are labeled as a female, I have to write something in it. Even though I can see that it states male to female, I have two options. I can avoid asking that person at all costs and be like, I know they're not getting a period. I'm going to write no period. That could cause risk of my license because I'm assuming I didn't ask, I didn't do my job. Or now I got to ask this person and be really awkward of when their last period was, even though I know they have male organs. Like, how do you deal with this? And many people have come across this and they don't know how to approach it. I do not make them know that I know they're male. That I know that they are not a male, okay? Biologically, I know they are male. However, I'm not going to assume that. I'm going to treat them like a female, like their chart says. So I'm going to be like, hi, ask them their name, everything, and be like, all right, any chance of pregnancy? They'll be like, they always say, no. And I'm like, okay, I just need to know when your last period was for your chart. And they most of the time, they are very understanding. They're like, nope, I don't get one. Never got one. Perfect. All right. I'm just going to document that and I'll be right in. I am not going to let them know that I know. I'm going to treat them like a female as they want to be treated. That's the main thing. Do treat everybody fairly and don't assume. The next one is educate your audience about how a lack of gender-based prevention, management, and therapy negatively impacts care for males and females. I think that is based off of just like the conversation I just had about the whole period thing. Healthcare needs to give a education on this stuff. It is becoming more and more more and more common. There's people that's non-binary, some people that don't like to disclose their gender. They might not even tell you what gender they are. It's just so broad that we are still learning, and I get that, but we need to keep up with the times of how we're going to approach patients, which leads me into our next question. Identify new approaches to gender-based care, such training medical professionals, changing clinical procedures, altering therapy and drugs that might benefit both of sexes. Explain why you consider them to be important. Mainly making sure everyone is treated fairly, no assuming, judging, everybody gets the equal care. I understand that people are raised a certain way. They believe in their things, and I understand that. And I know there's people in healthcare that don't accept it. The thing is, you're here to do a job, and do your job. Don't let it show. Be professional. Treat everybody fairly, and we'll get the job done. Mainly, education, keeping up with the times, keeping up with everything that's changing, how to approach people. Excuse me. And we would be a better healthcare system if we just treat everybody fairly and keep up with the times. That is it. I hope you enjoyed my presentation. Thank you, everybody, for listening.